Shingles looks like what they call a bullous red erythematous rash on a single side of the body that does not cross the midline. It typically is painful, and there are little fluid collections on the skin that look like blisters. Some would say, we call them in the medical world vesicles, but it looks much like the typical chickenpox rash might look like, but it really has a well-defined border and it only occurs on one side of the body. It's the only rash that has that characteristic unilateral nature. Is shingles contagious? The answer is it depends. It's certainly not as contagious as the chickenpox virus. You can't get shingles from another person's shingles. There is a chance that you could get chickenpox from somebody who has shingles, but that presumes that you've never had the chickenpox before. So if you've had the chickenpox, then you can't get shingles or chickenpox from a person who has the shingles. There is a theoretical concern in patients who are unimmunized for the chickenpox or have never had the chickenpox that they could come into contact with the skin or the fluid that contains the chickenpox virus and get chickenpox from the person's shingles. But that's very unusual. And it's really why whenever I have somebody who's diagnosed with the shingles, I tell them to cover up their rash. But it's not that contagious. But in very limited instances, it does become a concern.